Imagine an elderly patient, bedridden after a fall. They seem stable, but a silent threat looms: pressure ulcers. These sores, often called bed sores, form when prolonged pressure cuts off blood flow to the skin. The consequences can be severe, leading to infections, prolonged hospital stays, and even death. Understanding the risk factors for pressure ulcers is crucial in preventing this often overlooked problem. For years, medical professionals relied on intuition and experience to assess pressure ulcer risk. But the human mind, while powerful, is prone to biases and inconsistencies. This is where the power of statistical models comes in. Logistic regression, a type of statistical analysis, allows us to identify and quantify the factors that contribute to pressure ulcer development. By inputting data on a patient's age, BMI, medical history, and other relevant variables, the model calculates the probability of developing a pressure ulcer. This information empowers healthcare providers to make informed decisions about preventative measures, such as specialized mattresses, repositioning schedules, and skin care. The model, however, is not a crystal ball. Age is more than just a number, it's a significant risk factor for pressure ulcers. As we age, our skin becomes thinner, more fragile, and less elastic. This natural aging process reduces the skin's ability to withstand pressure and shear, making older adults more susceptible to pressure ulcers. Furthermore, aging often brings a decline in mobility. Conditions like arthritis, stroke, or dementia can limit a person's ability to move independently, increasing the likelihood of prolonged pressure on certain areas of the body. Reduced blood circulation, another common consequence of aging, further compromises the skin's ability to heal and regenerate. This diminished capacity for repair makes older adults particularly vulnerable to pressure ulcers. The logistic regression model takes this age-related vulnerability into account, assigning higher risk scores to older patients. This doesn't mean that every elderly individual will develop pressure ulcers. It simply highlights the need for heightened awareness and proactive measures in their care. By recognizing the impact of age on skin integrity and overall health, healthcare providers can tailor their interventions to mitigate the risks associated with aging. Body mass index, BMI, is another crucial variable in the pressure ulcer risk equation. Both ends of the BMI spectrum, underweight and obese, present unique challenges. Underweight individuals often lack the necessary fat padding to cushion their bones, making them more susceptible to pressure ulcers over bony prominences like the hips, elbows, and heels. On the other hand, obesity presents a different set of challenges. Excess weight puts added pressure on the skin, increasing the risk of pressure ulcers, particularly in areas where skin folds trap moisture and create friction. Moreover, obesity is often associated with other health conditions like diabetes and cardiovascular disease, which can further impair wound healing. The logistic regression model considers both extremes of the BMI spectrum, adjusting the risk score accordingly. For underweight patients, the model emphasizes the need for careful skin assessment and pressure redistribution. In obese individuals, the focus shifts to weight management, moisture control, and meticulous skin hygiene. Understanding the relationship between BMI and pressure ulcer risk allows healthcare providers to personalize preventative strategies based on a patient's body composition. This individualized approach is key to effective pressure ulcer prevention. Past medical history provides valuable insights into a patient's susceptibility to pressure ulcers. Certain medical conditions, like diabetes, vascular disease, and malnutrition, can significantly increase the risk. Diabetes, for instance, damages blood vessels and nerves, impairing blood flow to the skin and hindering wound healing. Vascular disease, which affects the arteries and veins, further compromises circulation, making it harder for the body to deliver oxygen and nutrients to the skin. Malnutrition, often characterized by deficiencies in protein and vitamins, weakens the skin's structural integrity and delays the healing process. The logistic regression model incorporates these medical conditions into its risk calculation, acknowledging their potential impact on skin health and wound healing. A history of these conditions serves as a red flag, prompting healthcare providers to be extra vigilant in their pressure ulcer prevention efforts. This information allows for early interventions, such as more frequent skin assessments, specialized wound care, and nutritional support, to mitigate the risks posed by these underlying medical conditions. By recognizing the interplay between medical history and pressure ulcer development, we can provide more targeted and effective care,